The mission here at Family Integrative Medicine is to provide high-quality, comprehensive care through multiple modalities, including acupuncture, chiropractic medicine, physical medicine, and also combining other therapies, including Western medicine, supplements, comprehensive integrative care.
And it works perfect in conjunction all together, and better result always.
For women who are undergoing assisted reproductive therapies like IVF or IUI, a lot of times we'll suggest that even before they start their IVF treatments or their IUI treatments, to start with acupuncture. Because I think you've had several patients like that as well. It helps prepare the body for that.
We had been married for about a year, and it was in 2010 we decided to try to have babies. And previously I had an IUD because the hormonal pills just didn't agree with my body. I talked to my doctor about it and we took the IUD out. And she said to just drink orange juice every morning and if everything should work out. And that started the journey of, you know, monthly disappointments. And it was stressful in and of itself. And so we slowly just kind of decided to, you know, try but don't try. And that went on for months, and then it turned into years. We had just turned 38, 39. Then COVID hit and everything got kind of put on pause for a couple years. And then they started seeing patients again, and they saw us and they said, well, biologically, you know, after they ran some tests, biologically, there's no reason why we shouldn't be able to have babies. There was nothing wrong with either of us. We started the journey of IVF doing retrievals. And that is a very stressful thing to go through. It's a lot of hormonal changes and stress and pressure.
So I find that stress and anxiety is especially detrimental to fertility. When you're in that constant fight or flight response, your body tends to tense up, and especially for women, we find that the fallopian tubes aren't flexible enough to catch the egg once it releases for those who are trying to conceive naturally. So it starts with decreasing stress and decreasing inflammation.
Then body knows, in my opinion, body knows this is a time for having baby, or it is stress hormone is high enough that you're on fight and flight stage. This is not a good time to conceive.
Emily was actually seeing Dr. Marie at your clinic for other issues that he had. And then Dr. Marie says, well, you get your wife over here and we'll start working on you and her. And that's how it all started.
We treat individuals, not conditions. There are so many factors, like how long you've had the condition, for pain conditions, if there's an underlying musculoskeletal problem. In the case of fertility, whether you're trying to get pregnant naturally or whether you're undergoing assisted reproductive therapies such as IVF or IUI.
There are many factors.
Let's try to keep everything very happy and loving and stress-free and try to be as comfortable as possible. And my husband really took that upon himself to make it happen in our home.
Even when you're undergoing these therapies, all of these external hormones can make you feel kind of crazy. So it helps to alleviate some of the side effects. It helps with egg quality. It helps with implantation.
Dr. Marie was always so loving. And I think that that's what really made a difference between her and all the other doctors that we've seen. She cared so much about helping us have a baby. that I think that that's what really made the big difference. Her treatments were always so stress-free.
We start with a very comprehensive and detailed intake. We get into your medical background, all of your complaints, not necessarily what you're coming in for specifically, although we will get into that. But acupuncture looks, like I said before, looks at the body as a whole. You know, so things that you wouldn't think maybe are related could be from an acupuncture and traditional Chinese medicine point of view.
And I was like, Lee, look at this. And he was just like, what?
It was just very much disbelief. So when I heard his heartbeat for the first time, I'd been told for so long that it wasn't going to happen. I'm pretty sure that I cried.
I was 6 weeks pregnant, and I told her and Teresa, and it was, you know, more crying and more excitement. I didn't have any morning sickness. And then her weekly treatments with a nice massage from Teresa helped me have a calm, relaxing pregnancy as much as I could. And he was just so small and precious.
To see families achieve their couples achieving their dream of becoming a family.
That's rewarding.
It's so rewarding.
Yeah, that's an amazing feeling to help someone, to bring a smile to their face, to hold their baby. It just, for me, it just very personal.
It was just such a sweet thing to see him for the first time. I'd say that it's worth a try. Acupuncture, it restored hope.